You're listening to The Q Switch with your host, Spence.
Welcome, one and all, to the Q Switch Conversations podcast. I'm your host, Spence. The mission of this show is to tackle subjects impacting ophthalmology and pull in leading eye care professionals and industry players to discuss their unique perspectives. So let's jump right in. Today's guest is Michael Lipson, CEO of MediQuip Biomedical, who will share his thoughts on the common struggles and solutions in scaling an ophthalmic practice. Michael, thanks for joining the Q Switch Conversations podcast and for making time for us today. Where are you calling from?
Thanks for having me. I am in Michigan right now.
So we're closing in on the end of Q1. How's the year started off for you and your team?
Excellent. Great year. We're showing progress, showing encouragement on new products that are coming out, new technologies, and applying them into practice.
So it is great meeting you, and thanks for joining the show.
Perfect.
Let's start by sharing the origin story and maybe include the light bulb moment that put you on this path.
I'm a clinical practitioner in ophthalmology and optometry practice. And basically, that's how I was kind of recruited for this, because I kind of bridge the gap between academics and clinic. I'm associated with a university group medical practice, and we are obviously involved in clinical care with patients, but also involved in research. And so finding some of the new equipment that is out and finding how it can apply to some of the current ongoing research and how to validate it for clinical use, and actually bringing it into practice for other local practitioners as well as on a national scale.
And so how did you get into this role?
Well, basically, as an optometrist, like I said, I had been in practice for a number of years and found there was an opportunity in this academic institution and to be able to be a clinical provider of eye care and specialty eye care, as well as being associated with some research facilities, was quite attractive. It's a prestigious University of Michigan, in an ophthalmology department, where basically I feel some of the highly and most qualified practitioners have settled into.
Well, I will tell you that I've been to Detroit. I know that Ann Arbor is a little bit farther away, but I've been to Michigan once. I enjoyed it. And as you said, the University of Michigan, prestigious university, and their ophthalmology department is absolutely stellar. I spent a little bit of time in academics myself when I was at Alcon. And although I didn't service that area of the country, my partner that did spoke very, very highly of the institution.
I'm very familiar with Alcon, both from the surgical and pharmaceutical side, as well as from the eye care, contact lens and contact lens solution side of it, though, as well.
And you're an optometrist by trade, I
That's
understand.
correct.
Okay, very well. Well, again, thanks for joining the show. What are some of the big goals for 2025 for you and the organization?
Well, certainly incorporating some of the new technologies that are coming out and being able to put them into practice and get them in the hands of our colleagues to be able to benefit patient care. Probably, some of the newer technologies in the ophthalmic industry are pretty exciting right now because we're able to get earlier diagnosis and better treatments for some of the more challenging situations in practice. But I think obviously the big buzzword these days is AI, and how these are going to integrate with AI and our practices and our patient care on a daily basis.
Well, you're certainly right there, and I actually have a question later on down the road. I think it's my last question regarding AI. So let's get into the subject at hand. Many practices nationwide are expanding, some organically, others by way of private equity and maybe mergers. If you could wave a magic wand to solve one thing for ophthalmology practices looking to scale, what would it be?
Well, scaling is a big thing because basically we have to keep in perspective the idea of taking care of a large number of patients and a large number of potential diagnoses for these patients, but also to keep the care on a more human and individualized basis, and to make it feel that the doctor really cares and they're doing their best for their patients. So it's a big challenge that way, because as you said, with the private equity taking over, some of the corporate policies make it a little less personalized.
So I get that leads into almost my next question is that, From your standpoint, what do you see as the biggest frustration with practices looking to scale, and why would you say that?
The frustration, I think, is being able to take this new technology that's really wonderful, being able to do things that we were not able to do before, and being able to bring it to the individual patient, not just to the whole practice, but to benefit the individual patient.
And if practices don't embrace and address this, what are the implications if they don't solve this very large and frustrating problem?
I think the implications are that the practice gets kind of left behind, that they are at a competitive disadvantage from a marketing standpoint, as well as just public relations, the view of the patients, the perspective of the patient of that practice.
And you mentioned the the competitive environment, and I think that's why you're seeing so many changes in the scaling of different practices because there's so many patients to be served. There's a lot of competition, and so if you again aren't up to speed and stay at pace with some of the different changes, as you mentioned, you get left behind, and eventually, you get eliminated, or you just have to and being acquired by somebody else.
For so many years, I think, as you talk about competition, for many years, basically practices were dependent upon word of mouth referrals. And certainly that is a powerful thing these days, but so much of it is done via marketing, via the internet, websites, et cetera, social media, all of those things. So that evolves in terms of how to project the image that you want to project to the public.
Hmm. So let's talk about capital equipment for a moment. In your opinion, how important is upgrading or expanding equipment like lasers, imaging devices, and diagnostic tools when scaling in today's ophthalmology environment?
It's really critical, I think. You can't underestimate the power of that, basically for a number of things. Certainly for patient care, relative to being able to provide state-of-the-art diagnostic capabilities for a variety of different conditions. You have to really kind of weigh what the benefits are. Is it, a new piece of equipment? Is this going to benefit your patient care? Is it going to benefit the practice relative to return on investment, so to speak? And I think that, again, communication with other professionals is critical on this as well, meaning that in a generalized type practice, diagnostic equipment that's being employed really can be used for the patient record, but to be able to push a button and send the results to a specialist who is also coordinating care with this particular patient, really, really important that way.
I agree, 100%. And so I think kind of on that same line of thinking, ophthalmology, as you know, is a very technology forward and quickly changing specialty. How can practices minimize the risk of investing in technology that becomes obsolete too quickly?
Oh, that's a tough one. Basically, you have to analyze what it's doing for you, for the practice, and be able to trust the company that's producing that piece of equipment, that they have looked into the future a little bit and how that's going to be applied and how it's going to be rolled into a long-term benefit for overall patient care. And the biggest area really is co-management and being able to cooperate with a team of doctors for a particular patient, so that rather than getting the results, sending a fax or sending a report, basically you can push a button on the machine and basically it's instantly transmitted to the appropriate referral source or team member.
One of the things I also find, and you can chime in on this as well, is that when a capital piece of equipment, say a diagnostic tool, it has to do several different things. Where the patient, for efficiency and clinical workflow, patient sits down once at one machine, it can do multiple things. Is that something that you find is an advantage and that practice should be leaning into
Well,
as they look to
that's
scale?
extremely helpful, as you probably know from a patient flow standpoint in the office. If you've got to basically position a patient in front of a device, basically head position, everything, chin position, disinfecting the equipment, keeping it clean, and essentially if you'd have to repeat that at different stations, that could be time consuming. And if multiple tests could be done at one location at one machine, it's a big time and patient flow savings, and it smooths out the process tremendously.
No doubt about it. I mean, that's what I found in my roles with Alcon and other companies that I've been throughout my career. That having multiple functions in one device is becoming more and more the norm, and more of a necessity in order to be considered as a technology to acquire for any given practice. And for those again those practices want to scale, being nimble and efficient is, I think, the ball game.
I think one of the in my particular field of specialty, the area of myopia management is becoming a very,
Okay.
very hot field right now.
Why is that?
Because it involves kids and the progression of myopia. And when we can talk about minimizing ultimate levels of myopia, we decrease the risk of long-term complications to patients. So the initial testing that's involved in myopia management involves obviously refraction, doing keratometry, topography, measuring axial length. All those functions can be done with one device. So you kind of played into one of the things that we're dealing with right now, that if one device, and especially on a 8-year-old child, they're not going to be as easily cooperative with that. So basically, if
Yeah.
they can be positioned in front of one device and generate all of those findings in one sitting, it's a tremendous advantage. And other things in terms of glaucoma, the same type of response would be generated too, like with OCT devices, if you could get both an anterior and a posterior segment OCT simultaneously.
Yeah, and one of the things I think that also that, again, part of, the ball game is that patient experience, that patient journey throughout the clinic. Is it efficient, and are they being paid attention to? That they feel valued as a patient, not just a number rolling through, and being able to maintain those standards to at a level where, again, the patient has a good feeling that they got their, not only their needs met, but they were valued. Is that something that you focus on at your practice, and how would you, I guess, recommend any practice looking to
I
scale
think
to
it's
incorporate
it's a
that?
critical thing to keep the patient involved, meaning if you can not only perform all those tests with this new high technology device and be able to explain it or have a visual representation of what was just being found, explaining it to the patient so they understand, wow, this thing did all that, in 3.2 seconds, that's great. And it's impressive for them, and they realize that this is not their grandfather's eye exam that they just went through.
Yeah, and I think you touch on something very important there when you allow the patient to be a part of the process. I mean, because again, this is their eyes, this is their window into the world, this is the way they function and get
Mhm.
around. And so, no one likes things being, touched to their eye. So, and puts them more at ease, allows them to understand the process and what's going to happen, and again, gives them a voice in their own treatment,
I
so to
think
speak.
kind of along the same lines, what you're relating to is that some of the treatments that we have been prescribing in the past have reacted to disease, meaning, okay, you've developed this disease, we want to react to that and respond and treat it in an appropriate way. And I think there's a definite move toward preventative care and being proactive in terms of their care and preventing these things from happening down the road.
And I think you're 100% right. And so, final question: AI, as you mentioned earlier, has kind of really taken root, and not only busted on out on the scene in 2023 with ChatGPT, but is certainly well within the medical field, and is clearly not going anywhere. What are your thoughts on the role that AI or automation play in making ophthalmic practices more scalable?
Think it helps in terms of the decision-making process by the individual doctor, meaning with a particular diagnosis, for example, glaucoma, there may be a variety of treatment approaches, and based on a number of individual factors or findings that are done diagnostically. And keeping up to date on those, each doctor is obviously going to have his own preference because of what they've experienced in the past, what they're comfortable with. But it is helpful for the doctor to have at their fingertips, they plug in this information and say, this is what AI would recommend. Based on these findings, based on the patient profile, this is the most appropriate treatment. So relying on AI to gather all the available information and then assist in the decision-making process on a treatment protocol is a real critical part of that.
Well, I think you're totally right. And again, AI is not going away. And again, if we can harness the power of AI and automation, I think it really adds to all the things you talked about in terms of efficiency, outcomes, diagnosis, clinical workflow, patient experience. I think it can play a role in all those areas of a practice looking to
One
scale.
other factor that's going to come into play might be the patient confidence or the trust factor. If the patient were to know that the doctor is using this AI to make their decisions, does that make the patient more or less confident in the doctor and in their treatment of choice? And so AI is new, and some people are embracing it and loving it and saying, I'm going to throw all my decision making into AI. The patient may not be buying into that as much. They may say they want a doctor who knows, not relying on a computer or some unknown entity making those treatment decisions for them. So that's a big factor in terms of how long the technology has been out and how confident the patients and the doctor can be in that technology.
I agree 100%. Well, Michael, I got to say that was awesome. Thanks for your time and sharing all your insights on the subject. I'm confident that our viewers will find it very, very valuable.
Well, thanks for having me. That's great. It's fun.
Good. Well, before signing off, if anyone watching wanted to connect with you online, where can they find you?
Basically, email is probably the best place right now. Just mjlipson@umish.
Awesome. We'd like to thank Riverside FM and Passionate Media for making the show possible. That's a wrap for this episode of the Q Switch Conversations podcast. Until next time, this is Spence, and I'm out.
You're listening to the Q Switch with your host, Spence.